Let's briefly talk about this term, paradoxical aciduria. This is a condition where a patient is producing acidic urine, but they are having metabolic alkalosis. And it is paradoxical because ideally, if someone is having metabolic alkalosis, we expect that the urine will be alkaline because their blood is alkaline. But now this person is having alkaline blood but producing acidic urine. This is a paradox. And how does this come about? This is seen in patients with gastric outlet obstruction and repeated vomiting. Remember, in vomiting, you are losing gastric juices, which are rich in hydrochloric acid, water, and potassium ions. So you're losing all this. And what the body does is replenishing them. It will have to replace these juices from blood components. And now some water component of blood is going to be secreted into the stomach to replenish these juices. More hydrogen ions from blood are going to be secreted into the stomach for production of this HCl into the stomach again. More chloride ions are going to be secreted in the stomach, but again we are taking these from blood. So, meaning we are reducing the acidity of blood. And this is where metabolic alkalosis starts. It has not yet manifested well, but it has started because HCl is now being taken into the stomach to produce gastric acids. And the patient is repetitively vomiting, meaning the cycle is repeating again and again until acidity of blood is really going to decrease to make blood more alkaline and even to make alkalinity worse. For every 1 millimole of chloride ion that is secreted in stomach trying to replace the lost chloride ions while vomiting, 1 millimole of hydrogen carbonate in the kidney is reabsorbed. Because we are losing a negative ion from blood, we have to replace it with a negative ion, and that is always the hydrogen carbonate, which is even making blood more alkaline. So at this point we would expect that, this patient is going to be producing more alkaline urine because at this point they are at a state of metabolic alkalosis. But here is where the paradox comes from. In this repetitive vomiting, we also lose water, meaning that if we are to replace the gastric juices, we do not only replace the acids, because it also has the water component of it, meaning blood will also lose some water into the gastric juices to replenish it because we've lost some. This will leave the systemic saturation into hypovolemia. We are going to have less of the water in the systemic saturation. This is a threat to the body even more than the alkalinity that is developing. So the body will take this as a primary concern and try to rectify it by activating the RAS system, which is going to promote sodium reabsorption in the kidney and water reabsorption so that the volume of blood at least goes back to normal fast, because it is key for perfusion of vital organs. By doing so, for every sodium that we reabsorb in the kidney, we have to exchange it with a positively charged ion, and this is usually potassium. So you're losing potassium in urine in exchange for sodium. And this is going to be done until extracellular potassium is depleted to a point that we need another positively charged ion to exchange for sodium, because we still need sodium so that we can get a lot more water into the systemic saturation, because the patients are repetitively vomiting. They are losing more water during vomiting, and blood is replenishing this water into the gastric juices again. So we are keeping a cycle of getting hypovolemia and activating the RAS system so that we reabsorb more sodium in the kidney, which will obligately call for water into the system. Do what? To counter balance the loss of water. So until potassium is depleted, extracellular potassium is depleted, that we need another positively charged ion to exchange for sodium reabsorption. That is where hydrogen ions will come in as the last option. And when we excrete these in urine in exchange for sodium, we are going to produce acidic urine, which causes a paradox. The patient is in metabolic alkalosis, but then they are producing acidic urine. And that is how it manifests. Thank you.